Hello everyone. This quiz is mainly for a conventional X-ray. After the tremendous expansion of radiology and imaging, nowadays this is ignored. But still many of the doctors and the practitioners are still using the protocols, which is very important for the diagnosis, and it is financially better for the patients. Going to give only one X-ray with three important questions. The first question, what is this X-ray called as? And you have to think about the three criteria to say it as that type of X-ray. Second question, for any imaging, preparation is essential. Here in this X-ray, how is the preparation? Is it good or fair or poor? And why do you say that? Third question is very much familiar, and that means what are the findings in the diagnosis. If you want more time, please pause the video and go back to see the images. Are you ready? Let's go. For the first question, this is the X-ray KUB. Here the X-ray is done to see the kidneys, ureters and the bladder. That's why KUB. In the conventional X-ray KUB, three criteria I said. One is superiorly it should be better to avoid diaphragms. Below, it is better to include pubis, ischium, obturator foramen and the hips. The third one is technically collimation is necessary for the best outcome, right? Now we'll go to the second question. This question is not only for the patients but also for the practitioners. This becomes important in the court of law with litigations being increasing progressively nowadays in our practice. X-ray KUB preparation is easy, but the X-ray KUB picture which we do is different individually and in the different circumstances. So now we'll go to the preparation. So ball preparation is essential for X-ray KUB and it is decided differently by different doctors and the professionals. But radiology residents and the radiologist should know whether the given X-ray KUB has good or fair or poor preparation and how to decide that. So we'll have three essential parameters. The first one, it is better to have no gaseous pattern in the areas of kidneys and bladder. That's more important, is to have no gaseous pattern in the areas of kidneys and the bladder. The second one is right and left psoas muscles should be well seen with the outer border of psoas muscle being so clear that it can be lined by a pencil from L1 to L5 vertebral level. And the third one, all the bones are clearly identified with well visualization of sacroiliac joints. It's very important. Sacroiliac joints also very important here. In our X-ray, some small gas pattern are seen overlying the kidneys, especially more on the left kidney. You can see the blue patch. Both the psoas muscles very clearly seen. You can see the thick arrows. Then the bony pattern so superbly seen except the sacrum. Small air pockets are there. It's good for the right KUB, but in toto, this X-ray looks fair. For the referred urologist, it is to see the right KUB. To him, it's a good preparation because the urologist is interested only to the right KUB, right? Now we'll go to the third question, findings and the diagnosis. In this X-ray KUB, we can see two DJ stents being seen in situ in the right side KUB region, and both of the DJ stents appear very close to each other from L4 to L5 level, and it was almost close up to the bladder. So the diagnosis is incomplete duplication with two separate renal pelvis and two upper ureters with fusion above the sacral level. That's the right answer. Nowadays, in many major hospitals, conventional X-rays are replaced by computer radiography and digital radiography, and hence the conventional techniques and the preparation are not specific now. But I thought nobody would give the answer in this quiz, which has been given through Google form. But to my surprise, few of them answered correctly, almost 100%, and many of the participants answered partially, almost 50 to 75%. Congratulations to all of you, and thanks a lot to the viewers, and have a great day.